All right, so I am 2 days post-injection. I lost track of what day I'm on. And I wanted to talk to you about the therapy that I've been doing all this time for my back. Like I've updated you guys on things, and I've told you that over time I've obviously gone through physical therapy and chiropractic care and all kinds of things. And the therapy that I'm doing now is nothing close to what I had done in physical therapy. It's there are no machines required, there's no weights required. I mean, I'm sure there could be in certain circumstances, but this therapy is unlike anything I've ever done, and the response that I get from it is no pain. Okay, so that's what this therapy is based on, and it's called McKenzie Therapy. And there are not many doctors that are certified in McKenzie Therapy. Fortunately, I found one, and for that, like I said, will be forever thankful. So what do they do? What is this McKenzie Therapy? Now, if you watched my episodes before, you saw the crazy little exercises. There was 3 of them that I had to do when the left side of my back was not being my friend. And then the right side decided it's my turn, and it started to hurt down my leg, sciatic nerve, everything. Had my injection Tuesday. So here I am. I'm doing a different exercise, which is in the McKenzie Therapy method. And how it's based on is what your response is. It's like a cause and effect of, does this exercise make your pain better or worse? And obviously that's kind of maybe what they do in physical therapy. I remember one time I was in pain and they kept making me do the same exercise. Not saying it was wrong or right. I'm just kind of saying was it working? Was it not working? I don't know. But I do know that what I've learned and what I was doing, what I thought was helping, wasn't. And, I could say, well, I'm a personal trainer. I should know all these things. We're not doctors. We are not doctors. So I couldn't tell someone like, hey, this is how you should fix it. No. I recommend doing this, okay? So the assessment and the treatment of low back pain is basically where McKenzie Therapy comes in. So it's not just a set of exercises like I had done in physical therapy, like the leg press, or I believe I did something over the stability ball and a lot of balancing type things, which yes, we're improving the muscle strength around my core and areas like that, but it wasn't getting to the root of the problem, which is what I found from McKenzie Therapy, that this is how it works. So based on whether or not pain is generated with these exercises that I'm doing, obviously I'll be doing the ones that are causing no pain, which make it better, which actually pushes things away from the pain. So it's based on the response. So what I'm doing right now is literally like standing in a doorway and sliding the bottom half of my body, my hips, towards the doorway. That's it. So that's where I'm at, and hopefully we'll continue to graduate. But what I've learned, and a book that I got that actually helped me understand everything that was going on, that I'll recommend to you. But remember, here's my disclaimer. This doesn't mean that you are a doctor. It doesn't mean that I'm a doctor. It doesn't mean that you can heal yourself. But literally, this book is called Treat Your Own Back, okay? And it's by this Robin McKenzie guy. So I would know nothing about this exercises or anything about the McKenzie Therapy method if I didn't find this doctor. So to me, I feel the need to continue to tell people about it and promote it because it's helped me so much. Yeah, I mean, I went from having pain on the left side to having pain on the right side, and people are like, well, what the heck? I don't understand. Are you fixed? My discs are never going to go back, but my left side pain is gone, and now we're working on the right side. So I have complete faith that this is going to work and it's going to help things. As far as how long it's going to take, like I said, I have to be patient. But I highly recommend that if you have any sort of back issues, and if you are in maybe my position or know someone that's been in this position where they were told, yes, you need surgery, and yes, you have this disc and it's pushing here and now it's causing more pain and maybe you need surgery, I highly urge you to check out a doctor. And like I said, I know one. There's not many in this area. I think there's 2, and one of them is kind of further away, but one that's local is the one that I go to, Dr. Del Real. He uses this McKenzie Therapy, and honest to God, guys, if I did not see the improvements that I saw, I wouldn't be like cheering and preaching about this the way I do. So tomorrow when I do go to the doctor, I'm going to get like my whole prognosis as to what we discussed more yesterday, so I can get like his exact verbiage as to where I'm headed, what could possibly happen. You know, anything can happen, but what were, based on my responses to the exercises, what we think is going to happen next. You know, and it's all, a lot of it is really based on whether or not you are faithful with these exercises, whether or not you have the attitude that, you know what, this can work. It doesn't need to be, you know, me having surgery. And I know I say that because I'm hoping like 3 months down the line, I'm not like, by the way, guess where I'm going today is surgery. You know what, if that happens, I'll flip out. I'm hoping it doesn't. I'm hoping with this therapy, honest to Pete, just like I said, was it yesterday that the doctor said, I've seen MRIs that are way worse than this, than mine, and these people have gone on to live without pain and had not needed surgery. So follow me on my journey, and I will post a link to this Treat Your Own Back in my blog, so keep an eye out for that. And then tomorrow I will update you all on what my prognosis is as far as where we see things going based on, like I said, the response of the McKenzie therapy that I'm doing. So like the graduation phases, like I'm back at the beginning again, just with the other side of my back. So patience, commitment to the exercises, and continuing with my treatment and staying proactive is where I'm at right now. And I do highly recommend that if you are in this same boat, before, unless you're like hell-bent on, like, I know I have to have surgery, before you make that decision, look into McKenzie Therapy, honestly, because it saved me. That's all I can say. So you guys, I just want to thank you all for getting on again and following this. And I don't, like I said, I don't ever want to feel like I'm like complaining, like, oh, poor me, poor my back. And yeah, it sucks. I hate it. And I hate that I'm in this position, but I know that over time, it's going to get better. You know, what doesn't kill me makes me stronger. And if I can get out there and help one person by just saying like, hey, this is what I've done. And maybe if someone's like, well, I'm going to try that, and it works for them, then I've done my job. So that's where I'm at. I'm just all about kind of trying to help people and let them know where I'm at with things. And, you know, I mean, like, this is my journey, and this is like real life and what's going on with me. So I'll see you guys all tomorrow. Thank you for joining me today. Have a good one.